Excellent. The session is being recorded. Welcome to Recovery Coaching in a Clinical Setting. As you see by the image on the screen for the first slide of the PowerPoint, it says, how can we engage clinical settings in recovery coaching? Hear it right up front, folks. I'm not here with answers. I'm here with a lot of questions. Whenever I do what I do, I'm a learner, I'm a doer, and a teacher. And especially in the 10 or 12 years that I've been coaching recovery, and especially through the 10 years that I've co-facilitated Recovery Coach Academy, I have understood the importance of that three-legged stool for Recovery Coach Academy. I actively listen, and my active listening is out of the curiosity that I have on how I might be helpful. In actively listening and giving into that curiosity, I ask good questions. I tell people more and more that even prior to coaching recovery or being introduced to the concept of recovery coaching, my own practice of the last 40 years has evolved from a research clinician, from a counselor in a variety of clinical settings. My practice has evolved to recovery coaching. And I'll give you some ideas about that evolution and how that evolution has come about. So in many ways, I feel as if I have some expertise in talking about this topic, and yet I'm offering more questions than I am uh, answers. And I think that's the way it is. I mentioned earlier that when I do what I do, I'm coaching. When I do Recovery Coach Academy as a co-facilitator, I'm a coach. In my role as a master coach, I coach. I coach the participants. When I'm sitting with individuals or families, I coach those individuals and families. And in the context of that work, I am having conversations that matter with them, I hope, based upon questions. My questions are based upon my curiosity. The curiosity that I offer is an effort to help people to discover and, more importantly, think about things in a way they have not thought about them before. When Stacy um, talked to me about presenting this particular webinar, as is the course, there's not a whole lot's been written. In fact, I found nothing that was truly written specific to the topic. However, that's for us to discover. That's for us to uncover. And I hope you'll have an opportunity to begin to discover and uncover the possibilities of your ability to begin to ferret out how to begin to start conversations that matter, that will support our ability to provide recovery coach services, not only in clinical settings, but in a variety of diverse settings. Many of the settings that we're already coaching in are emergency rooms. CCAR is beginning to really delve into the possibilities, or has delved into the possibilities of working in correctional settings. As I said, much of the work that I have done and looked at back as a clinical, especially as a clinical research clinician in treatment settings and in research settings, I believe has a place for coaching recovery as well. So again, in asking the questions I'm going to ask you today, and that'll be the value of you walking away with this webinar PowerPoint, is I believe the questions are potent. I think the questions are powerful. When I think about empowerment, it's about you taking responsibility for improving the quality of your service, about you being able to improve the performance of your role as a coach, and equally as important, your role as a human being, practicing humanity in settings where humanity is a critical part of the process. So in many ways, I don't have answers, but I have what I call solutions, Soulutions. I'm a social worker, Soulcial. And the soul in social work stands for strengths, overcoming, unmanageability, and limitation. And I want you to think about the unmanageability and limitation that you experience in your humble effort to provide recovery coaching services. in settings that may not receive them well, or the fit is not the best. And again, it's not about judging or blaming in the context of doing this work to improve the quality of our work in settings that may be struggling to embrace our work. This is about how can we engage in clinical settings in recovery coaching by having the courage and being brave enough to start a conversation that matters. A quote by Margaret Wheatley that appears on slide 1. Conversations that matter. I first picked up on that concept in doing Recovery Coach Academy with Phil Valentine. He talked about conversations that matter. That's an important concept to think about. How do we have conversations that matter? When I think about having conversations that matter, to me, that's about what I perceive to be the way of the caretaker. The way of the caretaker comes from the Fourfold Way of Living by Anjos Aryan. And you'll get a heavy-duty dose of that, of her work in this particular webinar, because I think it fits what I want you to think about. Because I think it fits with the questions that I want to ask you and have you think about. How are you going to move forward? Thatcher, you can't hear. Hopefully somebody will help you with that. But clearly, and again, when you talk about the opportunity to be caretakers and to have conversations that matter, it's about you and I paying attention to it as heart and meaning for the people that we're making a humble effort to help. When you think about paying attention to it as heart and meaning in settings, whether they be clinical settings, correctional settings, non-recovery oriented care settings, we need to not only pay attention as heart and meaning for us in our effort to perform the role of coaching recovery in those settings, but also paying attention to it as heart and meaning for those settings and their administrations. It's not about our throwing darts at each other, no pun intended, and nor is it about judging or blaming. The way to creative problem solving, again from the Fourfold Way of Living by Anjos Aryan, she says that the way of the creative problem solver, which is what I'm encouraging us to be, is to tell the truth without blame or judgment. I believe that we can do a better job of engaging those settings that may be struggling or we may be struggling in to provide these valuable recovery coaching services and to perform our role to our ultimate potential within those settings by our telling the truth and not blaming or judging. I found that the way I can begin to lessen or limit my judgment, because it's hard not to judge, especially when you're experiencing situations where you're not being all that you want to be or doing all that you want to do, or feeling that you're being treated as an object or recipient in a system of care. I think our ability to limit judgment is our ability to be curious. So I want you to begin to be curious about what are the challenges, not only for ourselves, but also for these settings that may be having a difficult time of engaging and embracing coaching recovery, and see if we can't do that. Glad you. Great. Good that you're on board, Thatcher. So let me move on to slide 1. And folks, any questions or comments that you have, please type them in. I know I'm not going to be able to get to them all because, again, I'm asking more questions than I'm offering any solutions. But, your input is valuable because, again, I'm here to learn as much as I might be teaching, because we all want to walk away with a better opportunity to do this work in more diverse and perhaps more challenging settings. So let's move on and see where we're going. The learning objectives of this particular webinar are to start a conversation that matters. And for me, that is to wonder about implementing recovery coaching in clinical and non-recovery oriented systems of care settings, and to begin to identify a science, or a term that I've been more recently introduced to, a method, which is basically what to do to support successful recovery coaching in environments that represent uncertainties, challenges, and stressors in the performance of our role. I don't know about you, but not every setting, especially care settings that I have worked in, care in the way that I care. For me, care has always been both a service, an action, as well as an attitude. Think about the attitude of care and how important that is. Think about how important it is to care, both as the service that we provide, as well as the attitude that we provide. And again, many times, some of the organizations that we work with, in your head or even out loud, you may say, they don't care. And I'm not judging. I'm curious on what are their challenges in providing care as the service and attitude that I think, for me, recovery coaching has epitomized. So those are where we're going. Those are the objectives of our learning. Those are the objectives, the questions that I will be offering you to think about as I offer you to think about these concepts in a way you may not have thought about them before. And the other part of this, folks, is that as you listen to these questions, and in particular, as you listen to what I'm offering and sharing, and if there are comments or questions that come up as you listen to my responses, I'm coaching. I think one of the advantages of having these webinars, and again, I do what I do in as many settings as I can do it. I believe it's helpful to be in a setting or in a situation where you hear people like myself who are mastering these concepts, how we offer them, because I'm coaching as I do this work. So listen to how I do that. Lack of education and language matters. Yeah, for sure, Nicole. And sometimes a lack of education is what we can do. One of my roles as a coach is to provide educational opportunities for people to learn and grow. And again, I think that's also in the context of the settings that we may be working in, or the settings that we're looking to impact, helping them to learn what we know about this valuable resource called recovery coaching. Next slide. I share right up front this whole concept of the science of recovery coaching, which are really the Recovery Coach Academy modules. That's what you have on the left-hand side. When I think about the science of recovery coaching, especially as I've co-facilitated for the last 10 years in Recovery Coach Academy, and many of you who've been through the academy will recognize these modules. Active listening, spectrum of attitudes. What is recovery? What is a recovery coach? What are the stages of recovery? What are the stages of change? What is cultural responsiveness? What is motivational interviewing or motivational questioning? What is self-care? What is wellness recovery planning? And what are the strategies and skills, i.e. the science, that we learn on how to do and how to support recovery? I love this image. This image says it all for me, because in this image, the science is what to do, and that's where we're going to focus. We're going to focus on questions. We're going to focus on perceptions and concepts that have made sense for me, that have resonated within my soul, that I want to pass on to you in asking you what I hope are good questions to offer you an opportunity to do your own art and to begin to develop your own art of presenting this science in the context of helping environments to have a better fit with coaching recovery and with recovery coaching and with recovery coaches. That's where those circles overlap. The science and the art overlap in wonder. I encourage people when they leave Recovery Coach Academy, where you picked up the science of coaching recovery, that you begin to wonder how to do it, how to begin to develop your own art of coaching recovery. And we're adding another context and another element to that for you to begin to wonder in developing my own art of coaching recovery, in particular in settings, whether they be clinical, correctional, research-driven, or those settings that I'm also calling settings that are not necessarily recovery-oriented or have learned what recovery-oriented systems of care offer. Those are the settings that I want you to wonder and offer opportunities to discover how to help those settings and how to help yourselves to have a better fit to be able to perform your role in providing this valuable service. Next slide. My circle again. The overlap of those circles. The science is what to do. The art is how you do it. And the start is wonder. Socrates once said that wonder is the beginning of wisdom. Wisdom. Wisdom to know the difference. The ability to be in a setting and you feel as if you're being challenged or stressed relative to performing your role as a recovery coach with integrity. It's time for you to gain some wisdom. The wisdom to know what battle to fight, what battle not to fight. The wisdom to know how you can be. And listen to this concept, how you can be a coach to that organization, not in that organization, to that organization, with that organization, for that organization. It's not unlike what we do in our role as coaches with recoveries. At some level, organizations, clinical settings are in their own ways in need of coaching relative to how to provide the service of coaching recovery. And for me, that's the real base of what I want you to think about. For me, that's what the wonder is. I wonder, how do I, without blaming or judging, this organization, this setting that I want to impact to the point that we can bring this valuable resource of coaching recovery into that organization and to the recoveries or the potential recoveries within that setting to the best of my ability. The wonder to know the difference on how to do that. Next slide. So far, I'm saying before I move to the next slide that I like this, Stacy. Thanks a lot. I like the fact that I'm looking at, treatment centers are 26% represented here. I worked in a lot of treatment centers. I actually was the director of an adolescent and young adult treatment program at Elmcrest Hospital years ago for about 4 or 5 years. I also worked on their clinical wards. I've been a clinical resource clinician. I've worked in treatment centers. One of the reasons that I moved beyond them because of the limitations that not only were presented within the treatment centers relative to their ability to, or desire to keep up with the numbers or finding a clear way of giving people what they wanted them to give, but also the frustration with the insurance companies that were funding people's stays that didn't always do a good job of understanding what those stays could really be about. When I think about treatment, I also think about the fact that I am my lived experience includes, in the course of my 40 plus years of recovery, includes 7.5 years up front in which I spent 40 or 50 hospitalizations in Connecticut Valley Hospital as a patient. That's an average of 5 or 6 hospitalizations a year. So I'm clearly also familiar with the role of being a patient in a clinical setting. So wonder is the beginning of wisdom. Let's begin our travels towards hopefully some wisdom to know the difference between what we can change and what we can't change in our efforts to bring recovery coaching into settings that might be struggling with or we're struggling in to provide what we think is have learned to be helpful in the provision of coaching recovery. Next slide. I love the wonder. I wonder circle. This is one of those images that offers you an opportunity to think about what are the components of wonder. Wonder is to discover, to think, to try out that thinking, to observe what happens as you try out that thinking and think and recording that. I'm more and more encouraging people to record your humble efforts to help. You know, I'm one who right up front as I began my back then they called my sobriety. You know, back in the 70s, I went through a program that were trying to help me to stay sober. Um, but in that same process, I was offered an opportunity to help others to begin to meet the challenges of improving the quality of their lives, whether it included addiction to alcohol or other problems in living. And so I quickly began this dual development where I was a professional as well as a personal development along the road of sobriety and eventually the road of recovery and eventually the road of care. Much of my work today is framed in what I call care recovery because that's really been the experience that I've had. Carol posits that my wonder is what does the recovery want and how can I help? That's what we're talking about. You know, what do they want? Paying attention to what has heart and meaning for the recovery is what I perceive that they want. And my questions are based upon my ability to understand that and then lend what I call this humble effort to learn and lend power. So, what do you wonder about what to do to successfully implement recovery coaching in clinical or non recovery oriented systems? What do you wonder about what to do to successfully implement recovery coaching in clinical or non recovery oriented systems of care? Wonder. Be less judgmental. Be less judgmental and blaming not only towards the setting that may be struggling, but also you who may be struggling. I found that I have to have compassion for my struggle to learn how to live, to learn how to help, to learn how to care, to learn how to be in the environments in which my livelihood and the livelihood of the people that I am making a humble effort to care for and care about are experiencing themselves in. You know, think about what do you wonder about what to do to successfully implement recovery coaching in clinical or non-recovery oriented systems or settings of care. Got a lot of typing going on as it comes up. I'll make some efforts to respond to them. Next slide. Just wondering. Yeah, not everybody's in the same frame of mind. Not everybody's in the same stage of recovery. And the other part of that is let's also appreciate that not being in the same frame of mind in recovery also means that people may not know what they don't know about recovery. So again, there's an opportunity. And also that applies to the settings that we work in, or the settings that we're making a humble effort to help within. So I was wondering, how do you begin to develop a science, i.e., a way to successfully offer recovery coaching in a clinical or non-recovery oriented care setting? Have you ever thought about this? Have you ever thought about if you're in a clinical or non-recovery oriented care setting, or in a setting that's just begin to understand that there may be some value to bringing recovery coaches in, and they're trying to do that, and so far the fit isn't happening as smoothly as well as it can happen? Again, versus being judgmental or blaming of myself and not being able to help them to move forward, or them in their humble effort to move forward. How do we begin to wonder, and be curious about moving forward. I think our job isn't to tell anyone our thinking, but rather to ask some questions that help them to see what our thinking is. Well stated, Thatcher. And Thatcher, there's applications to the questions that I'm offering in this particular webinar that I think hits exactly on that point. It's about in our willingness to have conversations that matter with these settings that matter to you and that you believe can matter to recoveries and their recovery process, we can ask more questions. Wonder and curiosity does it for me as well. Just wondering, again, what theories, techniques, skills, strategies, and wisdoms do you believe will guide the process of creating and developing a science that will inform the development of our art in coaching, in recovery coaching in diverse settings? This is putting responsibility on ourselves. This is about that feeding that passion to give back, that many people who come to Recovery Coach Academy or come to this work are experiencing. Recovery Coach Academy offers theories, techniques, skills, strategies, experiences, and wisdom that offer you some guidance in developing your art of coaching recovery. And now we're trying to add another dimension to that work in developing your art of coaching recovery, which is my life's work at this point. I'm engaging in some very powerful partnership with, among other people, Jim Wolfing and Carol Cruz, to be able to further my desire to help people to develop their art of coaching recovery beyond learning the science. I think many of us step into the realm of coaching without a clear awareness of how to do it. And not so much in relation to not having the science or the skill or the techniques, but the ability to embrace our wonder, the ability to truly, truly, truly master our performing the role in the context of what works for us and therefore works with recoveries. And believe me, folks, this isn't a judgment or blame. It's taking me 40 odd years to get to where I'm getting to, that I can think about and ask these questions. And so in many ways, this is work that continues in many realms. Nicole says, I wonder how to educate community providers about recovery coaching. Once I explained the role of recovery coach to ED doctors, nurses, use case management, it's a lot easier to work. Yes. I'm seen as an asset. Yes. Some problem probation officers will ask as if they have learned, if I can have a licensed clinician write a letter, even though I'm state certified. When it comes to, yeah, because they're trying, the more we help them to appreciate our role, the more we help them to appreciate our certified ability, and the more we're able to help them to, through our conversations that matter with them, appreciate our expertise. That'll happen. I worked for 25 years on the Mashantucket Pequot Reservation, and over the course of those 25 years, had involvements with probation officers that worked for the tribe and probation officers who worked with tribal members outside of in the probation department, the state probation department. And I began to develop a relationship with them where they respected my skills and my expertise and my ability to explain and my ability to help the direction of the probationers that they were working with, to the point that, yeah, they embraced my role and allowed me to write all the letters I needed to write. It's so much about our willingness to not judge or blame ourselves for what they perceive to be our limitations, but to help them to understand what our strengths are, continue to develop those strengths. And that's also part of our ability to have a better fit within these environments and these diverse settings. Next slide. I'm curious. And these were the questions. These are more questions. What do you see? And when I say see, through your intuition, your insight, your perception, and your vision. What do you see as the challenges and stressors facing recovery coaches working in clinical or non-recovery oriented systems of care settings? I think one of the powerful concepts that we want to explore, and again, I'm looking at this tallying of the percentage of people working and where they're working. It'll get, I'm no doubt, knowing Stacy's brain is going to give her an opportunity to begin to fine tune this type of learning, because we want to begin to get some feedback relative to what do you see and what are the settings that you're seeing it in, so that we can do a better job of going to 10,000 feet and looking down and see where we can have greater value in helping you to develop a science that begins to address your ability to wonder and develop your own art in being more diverse in our abilities to practice and perform our roles in more diverse settings. I'm also curious, what do you see as your role as a recovery coach in addressing and impacting these challenges and stressors in a clinical or a non-recovery oriented system of care setting? And again, folks, I'm asking you, sorry about the question mark at the end. I'm asking you to think about the environments and how you might impact them or address them, or do you? This is where having conversations that matter and having the courage and the wisdom and the knowledge and the bravery to raise the issues in a way that's non-judgmental, non-blaming, but can help us to solve problems. Some of these environments are not well prepared to understand what our role is, so it's up to us to teach them the science as well as the art that we're practicing in our role. Yes, that's what this is about. And that's what these questions are about. It's about you being able to walk into those settings and helping them to think about things in a way they haven't thought about them in relation to providing the service and supporting your role in providing the service of coaching recovery. Dr. John asks, I wonder how the difference in roles affects probation officers in courts can or should accept. I think it's practice. I think it's our willingness to practice. I think it's our willingness to, along the way, keep them informed in what we're doing and how we're doing it. And no doubt helping them in that process to appreciate the process and the progress that some might be making in moving forward in their probation situations. And again, let's help them to know that they don't know what they don't know, i.e. probation officers and court systems. I mean, how many court systems are beginning to look at recovery courts? Look at what's going on in emergency rooms and the value of that prospect. It's people, it's coaches coaching staff. Nicole says being overwhelmed at times, but I thankfully know how to say no so I don't become overwhelmed. My supervisor understands how important my self-care is, probably because you let her know. It's about letting people know what we need, just like we want recovery to let us know what they need in our process of recovering our status and recovering our ability to best perform our roles in difficult settings that are in relative to the fit of our roles. We can be of value. We're adding value to programs and settings. And that's part of what I want them to know up front, especially as you're interviewing for the job. Some of these questions are quite appropriate as you're interviewing for a job in a clinical or a non-recovery oriented system of care. As many questions they may ask you, ask them questions that begin to build their awareness and knowledge of, even though the job description asks for a recovery coach, they're clueless on how to implement that process. So think about the value that you bring, where right up front in your interview, you're interviewing them and you're sharing knowledge with them on how your role can and will evolve. Points, points, points. Next slide. Coaching recovery sub-roles. These are the roles of coaching recovery. Built upon into these roles are responsibilities in coaching recovery. Which recovery coaching roles might you perform in addressing and impacting challenges and stressors as a recovery coach working in a clinical or non-recovery oriented system of care setting? Think about that. What are the roles that you perceive to be most helpful in the nature of the work that you're already doing, whether it be a treatment center, a recovery house, a recovery community center, many of the roles and the settings that people are verbalizing in the survey that you're answering to. I'm also seeing an other as a great percent. It'd be interesting to know what that other is. But again, what do you see as the roles that will, out of these 10 roles of coaching recovery, and this is a part of you performing the roles in coaching recovery, which ones do you perceive to be most helpful, most potent in offering an opportunity to address and impact the challenges and stressors that we're talking about? What I'm doing at this point is continuing to share that overlapping circle image and helping you continue to focus on wonder, but this is in the context of the work that I do. Again, the evolution of my work has been both personal and professional. In 1974, I started out in a program called Dixwell Opposes Alcoholism in New Haven, Connecticut, and I went into that program as case number 074 because I had a significant problem with alcohol that over time necessitated 40 to 50 hospitalizations to finally address after 7.5 years and begin to enter some sobriety and eventually recovery. Along that way, for me, this has been the development in my own art and science of care recovery. And I call it care recovery because for me, the way I define recovery is it's turning my life over to care. And that's been the process. It's been a process of recovering my life through care. And that care is about not only my taking care of myself, but my willingness to let other people care about me and care for me and partner with me in taking care of myself as well. And this has also evolved into my professional development and the professional development of arts work. So when you look at this, my work has been clearly, the science has been the fourfold way of living, the life model of social work practices, White Bison resources, a book by a man named Rollo May called Power and Innocence, Reality Therapy and Choice Theory by William Glasser, occupational science, which Carol and Cruz and I are offering in an e-learning that we're doing that I think has a critical piece relative to our ability to truly look at people making their best fit in environments, including the environments we're talking about where we're making an honest effort to coach recovery. Many Roads, One Journey by a woman named Charlotte Castle, a PhD psychologist who herself was a part of 12-step programs and wrote this book, Many Roads, One Journey, moving beyond the 12 steps, not a way of judging or blaming or putting 12-step recovery out of the picture, but talking about, much like we talk about multiple pathways of recovery, Many Roads, One Journey speaks to that same kind of concept. The lessons of racism of the well-intended have been a critical part of this art and science of care recovery, as well as Illusions by Richard Bach, The Adventures of Our Reluctant Messiah is that subtitle, and a book by I'm blocking her name, a woman named Eisler who wrote The Power of Partnership. Fourfold Way of Living, I'm going to give you a focus for the rest of this particular webinar because I think it has value in helping you to think about the questions that you might want to ask and some of the ways of engaging other people that the Fourfold Way of Living has taught me. Also, occupational science is something I'm already endeavoring in the e-learning that Carol Cruz and I are doing. And the power of partnership is something I'll introduce down the road. When I talk about power, for me, power is Power. Partnership, overcoming weakness, empowering responsibility. Partnerships, overcoming weakness, empowering responsibility is my acronym for power. And I encourage you to think about that. And then on the right-hand side is my art. My art comes to empower you, household dart, and social work practice, which I've been doing since I graduated from University of Connecticut School of Social Work and wrote a paper called Social Work Practice, Casework with Spirits, Human and Distilled. I was 7.5 years sober at that time. Casework with Spirits, human and distilled. Let me move on so I get all the content in. Andres Arian has had a major impact on my life. She passed away a few years ago, and I continue to carry her work forward. If you've been in any trainings or any conversations with me, her concepts and her name always comes up. And I introduce you to her concepts and her name because I encourage you to follow up on what this offers, because there's a lot of information relative to how do we work together. How do we work in systems and settings and organizations that may be challenged in providing environments that offer the best fit for the work that everyone wants to do. She's recognized nationally and internationally for her personal and professional consulting with organizations, groups, communities, professionals, and individuals. She's a bicultural, cultural anthropologist, educator, mediator, and award-winning author. She was known for her deep commitment, integrity, and skills for facilitating positive and sustainable changes in individuals and organizations. That's the piece that's most potent and most powerful. And I want you to really think about relative to your willingness to follow through or continue to look at her work. She had a deep commitment, integrity and the skills of facilitating positive and sustainable changes in individuals and organizations. As a recovery coach, that's what applies for me as well. She always looked for what was possible beyond the knowable to serve the individual and collective greater good. That's where we are, folks, as we think about this concept of bringing recovery coaching to institutions, organizations, and settings that don't know and yet are serving. The Fourfold Way of Andres Arian, PhD. Again, if you've been around me, you've heard these before. She speaks about power. Power is experienced through showing up. Power is the way of the leader or the warrior. Love, that's heart and meaning, paying attention to what is heart and meaning. It's the way of the healer and the caretaker, which is what we are, and which what organizations profess to be, are, or need to be. We speak the truth without blame or judgment is what vision is about. The way of the visionary, the creative problem solver, which is what we are making an honest effort to do and be. Open to outcomes, the way of the teacher, the counselor. Be open to the outcomes. That's where wisdom lies. Wisdom to know the difference lies in our willingness to be open, not attached to outcomes. Thatcher states that a great acronym for power. Art, I learned that someone once that true power isn't an isolated pursuit, but rather a pursuit that comes from our ability. Yes, it's so much about working together. We are so much more powerful when it is shared, social, and communal and not personal. Well stated, Thatcher. The Fourfold Way. Folks, this has taught me so much about living a way with other people. Not only has it impacted my ability to perform my role in an enhanced way in coaching recovery and in my humble efforts to be a helper, but it's also helped me in the context of moving beyond being a victim of racism in my own mind and helping myself and others to be allies in the challenge and the struggle against racism. Racism of the well-intended has taught me a lot over the last 25 years in doing that particular course with Jim Wolfing, as well as practicing it in my daily living. And the Fourfold Way has had a major impact on how I think about doing that. Andres Arian embodied a deep commitment, diverse and extensive experience, and a clear and direct approach to her work with tens of thousands of individuals over 45 years. She held a consistent vision that the heart of, and here we go what you said, Thatcher, the heart of collective work also is supported a diversity of many points of view and possibilities. She wholeheartedly believed in the incredible power of what she called bridging work, whether between disciplines, and that's what we're talking about in bridging, the disciplines of clinical and recovery coach, peoples, cultures, when we talk about impacting the environments that we're coaching recoveries in, traditions or generations. She described her work as helping individuals and organizations to walk the spiritual path with practical feet. Woo! Recovery is a spiritual opportunity and it's a spiritual enterprise as I've learned it. And for me, Andres Arian's work has helped me to improve my ability, to improve my well-being, to improve my ability to perform walking that spiritual path with a practical feet. The way to wisdom, as Andres Arian speaks about it, is the way of the visionary or the creative problem solver. The creative problem solver tells the truth without blame or judgment. The creative problem solver has personal creativity, goals, plans, and the ability to bring their life dreams into the world. Andres Arian says that the world gets sicker if we don't bring our medicine into the world. Your medicine are your creative talents, your gifts, and your wisdom. To tell the truth without blame or judgment is the way of accessing what I mentioned earlier, the 4 ways of seeing: intuition, perceptions, insight, and vision. How well do you trust your intuition, your perceptions, your insight, and your vision to be able to have conversations that matter to help? Being fixated on what's not working rather than what is working is the shadow side of seeing. It's the shadow side of problem solving. So many times we become fixated on what's not working rather than what is working. That's what I'm encouraging us to do. And that's what I'm encouraging us to do in the settings that may be struggling with us. Wisdom equals knowledge, insight, and discernment. Discernment is a noun that speaks about the ability to judge well. In a Christian context, perception is the absence of judgment with a view to obtaining a spiritual direction and understanding. In the Christian context, discernment is the perception in the absence of judgment with a view to obtaining spiritual direction and understanding. Wisdom equals knowledge, insight, and discernment. Way to wisdom, Andres Arian. There can be an addiction to being fixated on what's not working rather than what is working. This is a tendency to look at life from a fixed perspective. It's a lack of recognition of personal blind spots. It's a tendency to magnify experiences and blow them out of proportion. And it's an inability to trust intuitive information. Being fixated on what's not working rather than on what is working is the shadow side of seeing. My perception is that when we're having challenges and fitting in environments, both we and the environments may have our own blind spots, may not be trusting our intuition on how to best help, and may be on the shadow side of seeing, which is the shadow side of the ability to truly be problem solvers. I'm curious what attitudes and involvement support a recovery coach's maintaining their well-being and quality of life in a clinical or non-recovery oriented system of care setting. I'm curious, how well do you treat the environment or treatment setting as a resource, even when it may be toxic or dysfunctional? I'm curious, how well do you treat yourself as a resource when you are challenged or stressed in your work environment? Something to think about. I'm curious. The way of the caretaker or the healer is to pay attention to what has heart and meaning for yourself and for others. These are the attitudes and involvements that maintain personal health and support the well-being, welfare of the environment, agency, or organization, as well as yourself, as well as the recovery. The power of love is both care as an attitude and an action. The power of love is the most potent healing force in the universe. Intensity is the shadow side of love. This is a very powerful piece for me. Check it out. Involvement in the spectrum of attitude speaks about we treat people as objects. The involvement looks like we're doing to people. And how we do to people is we control them by directing, lecturing, demanding, bullying, punishing, guilting, shaming, oppressing, and dehumanizing. When we view people as recipients or organizations as recipients, the involvement may look like we're doing for people. We're enabling by rescuing, explaining, indulging, infantilizing, manipulating, overprotecting, codepending, and depriving. I'm encouraging us to be resources to treat the organizations and settings that we're working in as resources and allow that partnership to develop by doing and being with people, being and doing with these clinical and other settings, and respecting by recognizing, valuing, acknowledging, respecting, partnering, encouraging, caring, and accepting. This is an extension of the spectrum of attitudes that you learn in Recovery Coach Academy. This is an extension of the science that in my own practice has developed into my art of involvement. Addiction to intensity, which is the shadow side of love, is often demonstrated by people who have a low tolerance for boredom. If life becomes too dull or routine, intensity addicts will dramatize, sensationalize, and exaggerate their life experience in order to feel alive. We, as addicts, intensity addicts, will use drugs, alcohol, or sex to intensify our experience and create the illusion of more vitality and aliveness. The intensity addiction to intensity. Another addiction, the way of the teacher, she speaks about, is to be open rather than attached to outcome. To be open to its outcome and access wisdom by learning how to trust and be comfortable with states of not knowing. The way to wisdom is the way to trust the container out of which the qualities of wisdom grow: clarity, objectivity, discernment, and detachment. The need to know, which is the opposite of the way to wisdom, which is the shadow side of wisdom, is the need to know. Addiction to the need to know is driven and compulsive about the need to know or the need to understand. Just like surprises or unexpected events, we're masters of control with strong trust issues. We're inflexible, blameless, critical, and arrogant. The need to know is the shadow side of wisdom. I'm curious, and I'm rushing through, folks, because I want to finish the PowerPoint. And again, I encourage you to get a copy of it. How willing are you to show up, stand up, and communicate your needs, challenges, stressors, and sense of being treated like an object or recipient in your work environment? How willing are you to advocate for recoveries in difficult clinical or non-recovery oriented systems of care? And how willing are you to advocate for yourself in a difficult clinical or non-recovery oriented system of care? The way to wisdom, the way of the leader or the warrior. This is the power of presence, and your presence can contain charisma and your placement, plus the power to communicate, which is content, timing, and placement, plus the power of position, which is the willingness to take a stand. The power of presence, the power to communicate, plus the power of position equals big medicine. And big medicine is power. Perfection is the shadow side of excellence and the right use of power. The addiction to perfection, been there, done that, is little tolerance for mistakes. It's little tolerance for exposure of my vulnerability. I equate vulnerability with weakness rather than strength. It's a denial of my humanness and investing all my energy in maintaining a cultivated image or facade of how I want to be seen rather than exposing who I truly am. Perfection is the shadow side of excellence and the right use of power. This is about working together, folks. This is about recovery coaching and clinical settings working together. As a recovery coach, how are your cogs working to engage with the clinical cogs that are working within an environment where we're working together to perform the best we can for recoveries. How do we accomplish this? For me, that's the development of the science of working in clinical settings and non-recovery oriented systems of care that is critical to our ability to truly be who we are as recovery coaches in settings that might be challenging us. For me, more information relative to my own art of this is being offered in some work that I'm doing with Carol Cruz. Actually, we're doing one tomorrow night called e-learning, and it's really about our ability to perform well in settings that don't always receive us well for whatever reasons. I've developed my own art relative to this science, but clearly this is an opportunity to add more to that. And for me, all of our work are works in progress and work in process. Got about 3 minutes, I see. Thank you for the thank yous. I hope this helps. That anything I do and anytime I do it, it's all in an effort to help. For me, help is HELP, a humble effort to lend or learn power. And I hope this encourages you. I hope this piques your curiosity. I hope this stirs your wonder on how you can begin to have conversations that matter with entities and settings that matter, that can bring recovery coaching even more impactfully into the world. Because we're moving there, folks. When I first started doing this work, we wondered. Nicole writes, our community care team meets to help make other providers accountable for recovery. Excellent. That's one of our ways we can empower ourselves and others, to hold ourselves and others accountable, and not holding them accountable in a forceful way, but holding them accountable through information, through, again, people like some of these slides. Get this PowerPoint. I share every slide that you see here. I've shared with recoveries. I'm beginning to share them with entities that are looking to improve the quality of their environments, to receive recovery coaching or receive recovery coachees. So, this is my passion at this point. I want to take us beyond the science and into the art. And no pun intended, but that's my work. I'm developing art as I develop the art. And that's been a long-term process for me, and it continues, and I'm very appreciative. Thank you, folks. Be well.